Today we'll give us a topic about the catastrophic hemodialysis, and we'll discuss together the many topics, and we selected this topic, hemodialysis catastrophe, just to show that we should take care of emergencies. I want just to declare that I learned a lot from Professor Ayman Refaie through the journey since I attached to this center in 1993 up to this moment. Every day I learn from him a lot. Professor Ayman.
Thank you very much, Professor Hussein, for the kind introduction. Now, in the next 20 minutes, I think we are going to share with you some of the nightmares that may occur during the hemodialysis sessions. Actually, these are the catastrophic and fatal complications that may occur during the dialysis session. In the agenda of my talk, I will discuss the different catastrophes and their causes and how they are presented, and then how they are managed, and give some examples by reported case reports. These are the five main catastrophes that could happen during the hemodialysis session: catastrophic bleeding or hemorrhage, fatal air embolism, catastrophic hemolysis, fatal anaphylaxis, and cardiac arrest with sudden death. We have to differentiate first between catastrophes and the usual complications that we may be confronted during the dialysis session. These are the frequent complications like hypotension, cramps, nausea, headache. This is not the subject of my talk. So let's start with the first catastrophe, which is the bleeding or fatal hemorrhage. The famous or most common cause of catastrophic hemorrhage is dislodgement of the needle from the patient. So the dialysis then could be deadly and fatal. Because this subject is very important, the American Nephrology Nurse Association created a collaborative special work group, which is called the venous needle dislodgement special project group. This group reviewed venous needle dislodgement occurrence, consequences, and recommended practice and guidelines to develop strategies and resources on venous needle dislodgement to be used by the nephrology nurses and other healthcare professionals, as well as by the patients and their families. I'm going to talk about a very important issue that could help in preventing this catastrophe, which is fixation of the dialysis needle. This is the proper way how to fix the dialysis needle. The needle should be fixed in a place by a rectangular adhesive fabric plaster, and the most important that we have, that we should have this strip, this tab of adhesive used to make the chevron in position under the needle and the tubing close to the adhesive fabric with the sticky side facing upward. Then we should uplift and crossing the two ends of these to be fixed like this way. This is the proper way how to fix the needle. This is very important, and this will prevent the dislodgement and the catastrophic bleeding. So we should follow these steps. Number one, we should be aware about the education for the staff and the patient and all care providing fixing the needle. The area around the vascular access should be large enough and should be cleaned and allowed to dry before cannulation. The hemodialysis unit should follow their organization policy and procedure, and I think Professor Samir Saleh in the first day advised and stressed that each dialysis unit should have its own manual that should strictly follow. Blood lines should be loose and should be looped in this way to allow movement of the patient without pulling on the needles. And if we need repositioning of the needle, the tab should be replaced. We should not use the same tab again. And the vascular access and needles should be visible all the time during the hemodialysis. This is very important not to be covered. And checking the vascular access should be part of the monitoring, like when we monitor the vital sign, pulse, blood pressure, etc. We should check for each time for the vascular site. So this picture is very, very important. We should not allow the patient to cover the needles. Another important cause of heroic or catastrophic hemorrhage is the vascular access itself, and commonly this occurs the rupture of the AV fistula secondary to infection. In this situation, the hemorrhage is controlled with tourniquet emergency until the patient is transferred for further management. Another reported complication of bleeding during insertion of femoral catheter with massive bleeding due to perforation of the femoral vein, which was catastrophic, and the patient died in this situation. The next catastrophe is air embolism. Although it is rare, but it's fatal and causing chest pain and tightness with dyspnea during dialysis. It could be suspected if we found foam in the venous blood line. This will show there is suspicion that air entering the dialysis system. Or disconnection of connecting caps or blood lines can also lead to air embolism, and this is usually occurs in patients dialyzed via central venous catheters. The symptoms of air embolism depends on the patient position at the event of embolism. If in the seated patient, the air tends to migrate to the cerebral venous system without entering the heart, so the patient will be presented by loss of consciousness and convulsions. While in the recumbent position, air tends to enter the heart and then the lungs, leading to dyspnea, cough, and chest tightness. How to urgently treat such situation? Number one, clamping of the venous line and stopping the blood pump. This is very important. Number two, positioning of the patient on the left side and with the head tilting